But let's now just go back a little bit in time, because Buteyko has a bit of a history in Australia. Tess, you're a physiotherapist, and you became a practitioner way back in, I think it was 1993, the year before I got involved. You were actually involved in the first clinical trial of Buteyko outside Russia, one that was conducted in Brisbane back in 1994. And your comments on the trial and the significance of the results were widely reported both in the print media and on television. So let's have a look at some of the footage back from the mid-1990s.
There was a control group who were taught conventional breathing exercises, relaxation exercises, conventional asthma education. The other group were taught the Buteyko method. Each of the groups were recording their daily symptoms on record cards. They had a dramatic reduction in their reliever medication, such as Ventolin and Buteyko, around about 80% at the 3-month point. They had a significant reduction in their steroid usage. They had improvement in quality of life, significant decrease in symptoms, and they certainly improved in their ventilation pattern, which is what we set out to change. The Buteyko group patients were able to reduce the dilating medication by at least 80% without having a decrease in those lung functions, and we consider that very significant.
So here we are some 14 years later, and like many Buteyko practitioners, Tess, you now work a lot with people who have sleep disorders. Do you see a similar trend with the acceptance of Buteyko for sleep disorders as there was with asthma back in the mid-1990s?
Yes, unfortunately, from looking at that clip, I can see how much I've changed in the last 14 years. But the acceptance, Buteyko as a therapy for asthma hasn't changed much in that time. And unfortunately, we're seeing a similar trend with the acceptance of breathing training for sleep apnea. Sleep apnea is making up to about 70% of the work I do now. But I think the conventional medicine is just as bamboozled and dismissive of the role of breathing therapy as something to help people with sleep disorders as it has been with asthma. And I think this is due to the fact that still the way people are breathing is something that's just not being considered. And I think in conventional medicine they've just lost the powers of observation. So, similar story as with asthma, when someone goes to their doctor with sleep disordered breathing, there is no analysis done of the way they're breathing at the time. Whether they're breathing through the mouth is just not commented upon, how fast they're breathing, how much the chest is moving. So I think, with these labels that are given to asthma and sleep disorders, all the focus is, the head down, let's look in the toolbox, what can we do? Is there drugs, is there surgery, is there a machine? But no one's looking at the way people are breathing. So unfortunately, I think the story with sleep disordered breathing is the same as with asthma. The underlying breathing dysfunction is just being totally ignored while they're looking for, symptomatic treatments only.
Thank you, Tess.